morning. Thank you for listening to Community Access. My guest this morning is Dr. Abbas Mohammadi, Columbia Dental founder and president. Good morning.
Good morning, Alison. How are you?
I'm great. I'm so happy to see you. How are
Good to see
you?
Good to see you as usual.
You're well?
Yeah, very well. Thank
Good,
you.
I'm glad. You have an amazing event coming up on Christmas Day, always giving back to the community. It's a free teeth cleaning. You did this for Thanksgiving.
Correct, yes.
And you're doing it again.
Correct.
So just for the listeners to know, it's from 9 to 2. It's at 43 West Middle Turnpike in Manchester. First come, first serve it.
Correct.
First
Yes.
come, first serve.
Correct.
And it's free.
Correct. Yeah. On a Thanksgiving, then also we had some treat. I mean, probably it's not proper to say we had sweet candy and chocolate, but we clean the teeth after. So we treat our patients with some treat, and then they got the proper cleaning and fluoride. So and that's the best time to have a treat after get that treat and have your then the teeth clean just after that.
How was the turnout for Thanksgiving?
Oh, very good. We were very busy. Thanks to of my few hygienists that I had, they made themselves to come on that day and help our patients. I have to step in too because they got very busy, so
Wow.
I helped them out personally as well.
What was the reaction of people who got their teeth cleaned? Were they grateful? Were they happy?
Of course, joyful, and this is the best. The best joy you get also. You provide something, and even they tell you thank you, or you see their eye expression. That make your day.
Sure.
Certain thing, you cannot, buy by money. Joy and helping people is something that it touch your heart, and it change lives.
Yes, it does. Yes, especially with teeth, right?
Correct.
It's
Correct.
very rewarding.
Correct.
Doctor, why did you decide to become a dentist? I don't think I've ever asked you that. Was it because you wanted to help people?
Yes. Back to my childhood history. I remember I was like 9 years old, and I have a very bad toothache, and was Friday. So Friday back in my hometown country equivalent to Sunday because everything is closed on Friday. So and I remember that pain was bad, but my mother was in so much distress to find somebody to help me because couldn't see her son to be in such a agony, and you as a mother, I'm sure you can imagine it.
There's nothing worse than when your
children suffer,
and you can't help them.
Yes,
It's the most horrible feeling.
Yeah, so she, we were looking, for dentists. Those days there were no online or any type of thing. So we have to walk through the neighborhood, and there are some dental offices that they have, let's say, the home in front, and they have the back house as a dental. So my mother we find in the neighborhood one of those dentists that. So she rang the doorbell. Finally, somebody came, opened the door, and they helped me out to get out of the pain. So the relief and I receive, and also the relief of my mother's distress. It really touched me, and I never after that I had always in my mind I wanted to be a dentist, and then also I wanted to be a dentist that to be available all the time, because I didn't want to see any mother with that amount of the distress. That really touched me on. So that's something subliminally I think affect me to become a dentist, and later on to create that business model of Columbia Dental to be open 7 days a week.
Yes, you've done it all. That's such a beautiful story. For our listeners who don't know, what country are you from?
I'm from Iran.
Love that. I love your story. I can't believe I didn't know that. That's so beautiful. And you did it. Here you are.
Yes.
It's amazing.
Yeah, it took me a long time. But yes, I did it. I had to, before even I came to America, I went dental school in Europe, so I had to learn 2 languages. I became twice dentist because when you graduated in another country and then you come here, then again you have to go through retraining. So it took me a long way. It took me 2 doctoral degree. It took me 2 different language to learn, but it's worth it, right?
Wow, that's
Yes,
amazing.
yes.
It really is. So how many locations does Columbia Dental have now?
We have 13 locations from Norwalk to Enfield. If you go from 95 and 91 north, and from 84th section, we have location from New Milford to Manchester, Connecticut. So we cover basically every corners of the state of Connecticut.
That's wonderful. And you provide all different kinds of dentistry, pediatric. Let's talk about some of these. Sleep dentistry. I've been talking to a lot of females my age. They're grinding their teeth when they sleep, and they all have to get these mouthpieces now. They hit CVS, they get one of those junky ones, they rip it out in the middle of the night, it doesn't work.
Yes, grinding of the teeth due to the anxiety it can be deleterious, and it can affect and damage the teeth. So night guard is a way to go. Of course, there are 2 type of night guards. They can come to our practices, and we can fabricate customized night guard, or they can go to CVS. Obviously, the one that we make it is customized, fit properly, and is way more effective than the one in the CVS. But bottom line, the whole concept it is you're not biting on a hard, you're biting on something squishy and softer. So that's why you damage your teeth less.
Right. When should parents start with their children, bringing them to a dentist? Age 1, as soon as they get a tooth?
American Pediatric Association recommend to be seen at age 1. At Columbia Dental, we have 2 fine pediatric dentists, and it's the best to start with the pediatric dentist because they had additional training to deal with the child, especially at that early age. So we want kids to have a good experience, and it's very important to have been seen for the first visit by somebody that is specialized and been trained to deal with kids.
Is there something like a fluoride or a sealant that you can put on their teeth?
Sure, we do topical application of fluoride in our children. Fluoride make teeth stronger. It's just, we call it like a vitamin of teeth, and it make it stronger so they get less cavity. Sealant is like a plastic or resin type of feeling that preventively we put on the molar teeth so they don't get the decay. So some study shows putting sealant at an early age can reduce the decay by 40%. So it's a preventive tool that our pediatric dentists are always recommending to our patients to do so.
And then how often should they come a year to get their teeth cleaned?
Twice a year, at least twice a year they need to come for cleaning. Obviously at the early age, like age 1, 2, they don't need to be seen, but after age 2, when they develop their primary dentition, then yes, they have to come, every 6 months.
And if they were only going to choose to brush their teeth once a day, is it better in the morning? Is it better at night?
Well, they better choose twice. But the night time is very critical because during the night we are sleeping and our body also is sleeping, so we're not producing that much saliva during the night. Saliva has a protective layer that fight the bacteria and fight the dental decay. For that reason, nighttime is very critical, but again, we recommend at least twice.
And then when should parents start thinking about braces?
They can bring their kids at age of 7 and 8. That doesn't mean we're going to start, but at that age, the orthodontist is going to evaluate and predict is going to be some type of growth problem, and at that time the earlier that we can intervene is better. The growth means growth problem of course of the jaw, like because people that having needed braces, it can be two different uh, issue. One would be anatomical or one would be dental. If it's just purely dental, then probably the best age to start is like around age 12. But is it anatomical? The earlier we intervene, we better off.
Do you still have the neat smelling gloves, like the different kind of scented gloves?
Sure, of course. In our pediatric, obviously, not in our the adult offices, of course. Yes.
But you do these things so that the children will be distracted and not fearful.
Correct.
So you have the scented gloves.
Yeah.
I'm assuming you have like a video. Is it a video playing that they can
Correct.
get?
They are different techniques, tactics, and you're right. Part of the treating the pediatric patients is distraction.
Mm. Let's go to the other end of the spectrum. What if someone needed dentures?
Mm-hmm.
What do they need to do?
Well, they have to call us. We have the laboratory in our Manchester location, and we can fabricate the denture in the same day. One of the main reason that people, believe or not, they call and they want their denture to be made at the same day is that their dog is eating. And dogs, because they like you, and the denture is like a smell you, so they think it's you, so they that from their love they start
Yes.
chewing it, and then when they especially the bigger dog, they make these denture to 100 different pieces. To believe or not, I had one of them on Sunday. So patient came, was living in Torrington, and came all the way from Torrington, lost his had lower denture. Luckily, the dog only got access to the lower, so she was there for a quiet bit time, because we can do it in the same day, but the thing with the denture, it takes 5 steps. So we need to take the impression, then another impression, then they make the bite, make a mold, then process the denture, and the patient we need to train in the process. So the poor patient was there since 9 o'clock, and then went to the mall, come back, and then again went to the mall, come back, and finally, we start 9 o'clock, but around 3:30 we inserted the lower denture. But we do have the capacity to do all at the same, but obviously only in our Manchester location, because other location they don't have that capacity, nor many other offices, other dental offices, they don't have the dental laboratory on premises.
So if you're listening, do not leave your dentures where your dog can get at them.
Correct.
And
yes.
I know that I am vain, and I have 2 loose teeth at the bottom, and at some point I'm gonna have to get dental implants. So that poor woman, she didn't want to talk without her bottom dentures
Of
in.
course, yeah, of course, yeah.
So doctor, let's talk about tooth whitening.
Uh-huh.
Is it for everyone? What if you have receding gums? Is that something you can't do?
You got it. Unfortunately, no, it's not for everybody. So you got to the point. First of all, definitely you don't want it to do widening with somebody that have cavity. So one of the main thing it is, before do the tooth widening, we need to do a comprehensive exam, because imagine these teeth widening basically are acid. Okay, the way they work by demineralizing the enamel of the tooth, and they allow the new enamel to be reproduced by the body. But if you put acid on the top of the decay, it just making it worse. It make it painful. You may end up even need a root canal if you dump the things, bleaching your teeth when you have the decay. If you have recession, you're already sensitive, you put acid on it, it's not a good idea. Even some of my patients, they come to the office because they're using those products, not by us, but they're using it from Walgreens, CVS, or anywhere they get it. They're using it excessively and they get a lot of sensitivity. Unfortunately, bleaching is not for everybody, and we highly recommend before the bleaching to be evaluated by dentist. Of course, there are other ways to do the treatment before the bleaching. For sometimes that has a recession, maybe we can cover those receded area with some type of bonding or composite filling to protect it before we perform the bleaching. I'm not saying that we cannot do the bleaching, but before we do the bleaching, we have to evaluate the patient and perform the necessity treatment ahead of the time.
I'm speaking with Dr. Abbas Mohammadi, Columbia Dental founder and president. They can go to columbiadental.com to learn about all of the other programs and services that you offer.
Correct, or they can call us 860-645-0111 7 days a week.
And Dr. Abbas Mohammadi is giving away free teeth cleanings on Christmas Day between 9 and 2. It's at the office in Manchester at 483 West Middle Turnpike. First come, first serve. Thank you so much for doing this again, for caring about people. I love that this little boy grew up and did exactly what he said he was going to do. It's a beautiful story.
Thank you, Alison.